Hi, I'm Dr. Ray Foxworth, President of ChiroHealthUSA. After working with over 3,700 practices nationwide, I can tell you there are some common denominators in our profession. We all have the need to grow our practices, and sometimes the things we do with great intentions don't turn out so well. For example, offering free or discounted services. Helping our patients is doing the right thing, but we need to do it the right way. There are layers of rules and regulations that we need to be mindful of when we offer free or discounted services. And to complicate things, what's okay in one state may not be okay in another. For those of you who are old enough to remember the TV game show, Let's Make a Deal or The Price is Right, you've seen people jumping up and down yelling, "Pick me, pick me." That certainly isn't something you want auditors or investigators to do because of your marketing and office policies. Always remember, when you market your practice, patients aren't the only ones who see your ads. So let me share a simple process to use before you offer free or discounted services. First, you need a clear understanding of the layers of rules and regulations that we operate under as healthcare providers. Here's a visual to help you. I consider this the lens or filter we need to run things through before we offer free or discounted services. The first layer is your State Board of Chiropractic Examiners. Some states allow the offering of free services, Groupons, and other discounts, while other states specifically prohibit these types of offers. So ask yourself, is this okay with my Board of Examiners? And don't rely on word of mouth or rely on what others are doing as a green light. What is often commonplace doesn't mean it's compliant or legal. If the board rules aren't really clear, ask for a legal opinion. The second layer is your provider agreement, such as Blue Cross Blue Shield, Aetna, Cigna, United Healthcare, and others. Some companies have terms and conditions in their agreements that prohibit the offering of free services or discounts. Some of these companies even have published bulletins that warn providers that offering free services is considered an inducement and can result in termination from their networks. The third layer is your State Department of Insurance. In some states, the Department of Insurance or other regulations have rules against charging more to insurance companies than you do to a patient paying cash. Despite these rules, we know this is a common practice, and we know of several cases where practices have been investigated. The fourth and fifth layers are Medicare and the Office of Inspector General, and even the State Attorney General's office in some cases. The OIG is responsible for the financial integrity of the Medicare fund, and they are very clear about what you can and cannot do when it comes to offering free or discounted services to federally insured patients. You cannot offer any service with a value over $15 or a total of $75 in a year. Violation could lead to civil money penalties up to $10,000 per occurrence. So you can see how easily a violation could occur if you offer a free exam or x-ray. You must make sure that you get a green light at every level. Years ago, all we had to worry about was our State Board of Examiners when we were advertising free or discounted services. We could add a disclaimer stating, "Does not apply to federally insured patients." Fast forward to today, when many states have adopted the federal guidelines to prohibit inducements and kickbacks, and health plans have added language prohibiting the offering of free or discounted services, and you can see how easy it is to run afoul of somebody's rules and end up the subject of investigations. Quite frankly, that's why discount medical plan organizations like ChiroHealthUSA exist. The DMPO model allows you to offer legal, network-based discounts following the same model as Blue Cross, Aetna, Cigna, and other health plans. While we all need to market to attract new patients, make sure that your efforts comply with the layers of regulations so that your good intentions don't turn into a poor outcome for you and your practice. If you're not already part of the ChiroHealthUSA family, we invite you to join over 3,700 of your colleagues and over 500,000 patients who are part of the network that works for chiropractic.